Welcome to Swedish Medical Center Edmonds campus. I'm Lane Walsh, a family educator with Swedish's Birth and Family Education Department and a mother of 2 children born as Swedish. Having a baby is an exciting time for most families, but it can often feel overwhelming. We want you to feel as prepared as possible for your upcoming birth. Take a tour with me as we show you where to park and enter the hospital, how to get to the birth center, and what a birthing suite looks like. You will also learn about amenities and resources available to you and find out what to expect when you arrive to have a happy birthday. When you think you are in labor, call the clinic you go to for your prenatal care. Your doctor or midwife will contact the birth center staff to let us know you are coming. This allows our medical team to prepare for your arrival. Enter the hospital through the main entrance. You can park near the main entrance or you can use the parking garage. Follow the main hallway along the blue wall past the east elevators until you reach the west elevators. Take the west elevator to the birth center on the 7th floor. OB triage is the first stop for most families. This is the area where you and your baby will be evaluated to see if you're ready to be admitted into the hospital. Our team will assess the progress of your labor and monitor your baby using an electronic fetal monitor. This information gives us a good idea of how your baby is doing with labor. Let's go look at a birthing suite. When you're far enough along in labor to be admitted, it is usually time to find ways to cope with your contractions. We have many resources and tools available for you to use. Each of our birthing suites has a private bathroom with a jacuzzi soaking tub and shower, a bassinet for the baby, and a fold-out sofa bed for your support person. A birthing ball, rocking chair, and a squatting bar are also available. Your nurse will help you move into more comfortable positions, which can help facilitate the birth process. Additional items are also available in a comfort basket to help support relaxation during labor and birth. Items such as a hot-cold compress, aromatherapy oils, tea lights, lavender sachet, squeeze balls, and a handheld massager are some of the items available from the comfort basket menu. If you'd like an epidural for your birth, an anesthesiologist is available 24 hours a day. If there is a need for cesarean birth, you will be taken to an operating room for the surgery. As long as you are awake for your surgery, you may bring one support person in addition to your doula or an interpreter if needed into the operating room. Once you leave the operating room, you and your baby will be taken back to the birthing suite. If your baby is born full-term and medically stable, the baby will be placed immediately on your belly or chest, skin to skin, for the first hour after birth or through the first feeding. The first feeding usually happens 30 to 60 minutes after delivery with the help of your nurse. Feeding your baby is an important skill for every new parent to learn. We have nurses and lactation consultants available to provide you with the support you need. You can plan on having your baby with you during your entire hospital stay. This is called rooming in. If your baby is born preterm or has other medical issues, the medical team from our Level 2 Special Care Nursery will attend to your delivery and be available to provide medical care once your baby arrives. In these situations, it's common for the baby to spend some time receiving care in the Special Care Nursery. You and your baby can plan to stay in the hospital 24 to 36 hours after a vaginal birth, or 48 to 60 hours after cesarean birth. We encourage you to have one adult support person stay overnight with you in your room. It is recommended that you have your baby's medical provider picked before you arrive at the hospital in labor. We will be doing various health screening tests on your baby, and we will need to send the results of those screening tests to your baby's healthcare provider. These tests include a hearing screening, metabolic screening, and a cardiac screening, which screens for newborn heart defects. It is Washington state law that if your baby is traveling in a vehicle, your baby must be in a car seat. We recommend that you practice installing the car seat before you arrive at the hospital in labor. And finally, let us tell you about a few resources that Swedish has to help you adjust to life as a new family. Birth and family education classes are an important way to help prepare you for childbirth, as well as for life after your baby arrives. Swedish doula services are available to give you emotional, physical, and informational support during your pregnancy, birth, and after your baby arrives. The Lytle Center for Pregnancy and Newborns at Swedish First Hill in Seattle is available to you for additional services. Thank you for joining me on this tour of the Swedish Edmonds Birth Center. I hope you feel more informed about what to expect during your visit. For more information or to ask any further questions, please call 1-800-SWEDISH or go online to swedish.org. As a patient at any of our Swedish campuses, you have access to the best in personalized maternity support. We are here to help you and your family have the best birth experience possible. See you soon!